Hi there, it's Dr. Collins. I want to talk about something that has been controversial for decades, controversial in psychiatry in particular, and it's electroconvulsive therapy, or ECT, okay? You know what the procedure is. I wrote an article talking about or addressing specifically how patients who experience it now, how they feel about it. So the article is that I wrote, Electroconvulsive Therapy, ECT, and how patients feel about it. So let me start a little bit, and then I will go into some details. So ECT has been controversial, it's been stigmatized, and it basically is a psychiatric practice in which volts of electricity are passed through the patient's brain for a very brief amount of time. ECT has a very long and interesting history. Originally, it was called electroshock therapy, which sounds kind of terrifying, right? And it's been used for individuals who suffer from very severe, it's not used for any mild, moderate case of psychiatric condition. It is used mainly and has been for severe, debilitating depression, major depression. And it's also used for patients who have tried lots of different types of medications and nothing worked. So that would be considered a medication-resistant condition. And it has been used for years for individuals who are diagnosed with schizophrenia. Okay, so do you remember the movie One Who Flew Over the Cuckoo's Nest? You know, the practice of ECT was demonized, stigmatized in that movie. And there's another one too. I don't know if you've seen this one, Requiem for a Dream. That's a good one. So not just those two movies, but popular culture has really made this practice like a dark and a disturbing type of psychiatric treatment. But let's get down to reality. You know, how do patients feel about it? Take Hollywood and all that other stuff out of it. And while there are some mild side effects like short-term memory loss, a little headache, some drowsiness, or some muscle ache because of the electrical jolt that's happening, most patients find it very helpful. And that's the point of this video and my article. The actual patients who are going through the procedure, they're diagnosed with schizophrenia, major depression. They've been on so many medications and these meds have not worked whatsoever. ECT has either saved their lives or has created a much better quality of life for them. That's how patients feel about it. Here's some other information that I've found out concerning how patients feel about ECT. They feel very well informed about the procedure because the medical team educated them, took time with them, gave them the information that they needed, and they fully understood the procedure. They were also involved in decision making. So patients who have gone, most of them who have gone through the ECT experience indicate that they felt empowered. And that's extremely important if you have severe mental illness. They also indicate that they were treated with dignity and respect. That's wonderful. And they were treated very well by the staff. So the point that I'm making is ECT, you know, even when I bring it up in circles of healthcare professionals, they're like, ooh, ECT, electroshock therapy, electroconvulsive therapy, bad. And it's gotten a bad rap, but it has been very effective as well. And the procedures today are very, very simple. They're 120 times safer than the procedures in the 50s, 60s, 70s, 80s, and so on. So there you have it. There's my spin on ECT and how patients feel about it. I'm Dr. Jim. Keep coming back for more. Thank you.